pharmacy world, a pharmacist has many duties. Some of the most important tasks of a pharmacist is to assess a patient's profile, give dosing recommendations, and determine ways to make the best use of the pharmacy inventory. In this crash course, we will help you with common pharmaceutical calculations. Parker Peterson is a street performer that poses as Spider-Man with tourists in downtown Manhattan. When going home, Parker decides he's going to take a shortcut through an alley, but gets attacked. He was able to fight off the attacker, but was bitten during the fight. Knowing that a human bite will easily lead to infection, he heads over to the nearest hospital where he will be admitted and treated for human bite prophylaxis.
Your team decides to treat the patient with ampicillin sulbactam, which is used as an off-label indication for human bite prophylaxis. Labs and a physical assessment were done on Parker. Relevant information for the patient can be found below. Note the location of the serum creatinine value in the BMP labs on the bottom row, third from the left.
The first step in treating any patient is to evaluate their renal function and document any drug allergies they may have. Based on Parker Peterson's labs below, calculate his creatinine clearance using actual body weight.
To be able to do this, use the Cobb-Krupp-Gault equation. You want to make sure you have the age of the patient, the weight of the patient converted to kilograms, the serum creatinine value, and whether or not the patient is male or female, since the value needs to be adjusted by multiplying by 0.85 if the patient is female. After finding the creatinine clearance, you do some research and find the information for renal dose adjustments. Verify that your creatinine clearance value correlates with an elevated serum creatinine. Normal creatinine clearance in a female is around 100 milliliters per minute and in a male 125 milliliters per minute. For patients with renal dysfunction, that value can be less than 30 milliliters per minute. See that your answer falls within an expected range. Based on your calculated creatinine clearance, which dose would you recommend to a physician? After calculating Peter's creatinine clearance, you find that the recommended dosing is 1.5 to 3 grams every 12 hours intravenously. The physician decides to treat the patient on the higher end more aggressively with 3 grams IV every 12 hours. This medication comes in a 3-gram powder vial and requires reconstitution for IV use.
According to the package insert, your technician reconstitutes the vial with zero water for injection to achieve a final concentration of 375 milligrams per milliliter for one dose. How many milliliters of zero water for injection should your technician add to the vial to achieve the desired concentration?
The physician intends for this treatment to last for 5 days. Based on the order of 3 grams every 12 hours, how many vials of ampicillin sulbactam are needed to complete this course of therapy? Make sure you review your answer and that it makes sense, knowing that giving a dose every 12 hours correlates with 2 3-gram doses per day. Congratulations! You saved Parker Peterson. We hope that you found this crash course beneficial. Pharmacists are an important part of the healthcare team, ensuring that patients are receiving the proper medications and doses based on their conditions and ability to metabolize drugs. Thank you.